Hi, Joe Flower here. Let's take an 8-minute deep dive into healthcare economics, or why does it cost so friggin' much? We'll start with an EKG, an electrocardiogram. Actually, two of them, same hospital, same machines, wildly different costs. An EKG is nothing exotic. Choosing Wisely, a website put together by doctors to help you choose wisely, says it should cost about $50. Now, according to a story in yesterday's Philadelphia Inquirer, 61-year-old George Hahn had two EKGs. The first one discovered he had a problem with his heart. He had an operation, and a year later he had a follow-up EKG. Same hospital. The first one cost $339. The second, $3,484. For his part, out of pocket, he paid $170 for the first and $3,101 for the second. Can you imagine buying anything, an iPhone, a Ford F-150, a bicycle, anything, same product, same brand, same quality, for 18 times as much down the block, across the street, or even in the same store on a different day? Can you imagine being forced to? Can you imagine not knowing but until you get the bill? Anything? Nuts, huh? Normal. And I'm about to show you why. The United States is supposed to be the greatest capitalist success story in the world. We've got lots of problems, but at least the free market brings us all kinds of great stuff at all kinds of prices we can afford. The whole country is one giant mall and food court. It's all Costco and Walmart and Amazon, except in healthcare. The biggest industry in the country, the biggest business sector in the history of business sectors, has been whooping this capitalist economy's ass for decades. Healthcare has planetary inertia, gas giant inertia. It snacks on cost-cutting schemes and regulations and just gets bigger. It down slices of the economy, 12%, 15%, 18, 19, just gets bigger, right through recessions, through reforms, through budget cuts. It's hungry-mungry, getting us, all of us together, to pay more for their product than any other country while getting less of it and poorer results. Why? Okay, let's compare and contrast. Capitalism, healthcare capitalism. They're different. Consider what you go through to buy a car, a house, a breakfast burrito, or some toenail clippers. You know what you want. Maybe it's a 4-bedroom McMansion within a 45-minute commute of work. You know roughly how much you're willing to pay. No, I'm not going to pay $400 for toenail clippers. Don't be silly. Or even $15. A couple of bucks tops. You know or can easily find out what different places will charge you for that car, locally, online, however you want it. There are plenty of choices and plenty of places willing to supply what you want. Nothing constrains your choice. It's perfectly legal to pick up that breakfast burrito at any of a dozen different places along your commute route. That's how capitalism is supposed to work. The end user, that's you, makes or at least influences the choice, has options to choose between, and has plenty of information to power that choice. Buyers with choice, options, and information. If you constrain any one of these, the cost can go kablooey, and suddenly you're back with Teddy Roosevelt battling Standard Oil. Market concentration, monopoly-like conditions allow the seller to close off your choices, cutting off your options, throttling the information you would need to choose wisely. Now, how does that work in healthcare? Let me introduce you to my friends, Mr. and Mrs. Chalk and their kids. They need medical services, doctors, clinics, emergency services, drugs. But to get to those medical services, they have to go through intermediaries, these large medical organizations that are almost all paid fee for service. That is, they get paid for each thing that they do, each test, each visit, each prescription. They don't get paid for the thing that Mr. and Mrs. Chalk are actually trying to buy, say a well-birthed baby, a diabetes treatment, a knee operation. It would be like you going to a restaurant. You want a steak medium rare, a Caesar salad, maybe a glass of wine, but there's no price in the menu for any of those. Instead, you actually pay to rent the grill per minute. You pay for someone to chop up the lettuce. You pay for them to take a trip to the fridge for the olives. and the cook decides what goes into the dish. Maybe he throws in some of that $5,000 a pound saffron because he thinks it will really make the dish. So there's no price for the thing you actually came to buy, and no way to know how much you will pay. So you can't act like an actual customer and buy what you need at a price you can see for a reason you can understand. But it doesn't stop there, because the risk to you is so great. A bump on the head or a tummy ache that won't quit, might mean nothing. Might cost you a few hundred. Might cost enough to buy a house in San Francisco with no mortgage. So you have to have insurance to lay off that risk over time and across the population. So you have to go through another intermediary to even get to the medical intermediaries, a payer, such as a health insurance company. That's how it works. Can they act like a customer for you, helping you choose and pay for the best services at the most reasonable price? Fat chance, no. They have to do massive deals with entire medical organizations. There are gag clauses that keep them from even sharing how much they really pay. The contracts shift all the time so that it can be not just hard, but impossible for you to even know whether your insurer will pay for this MRI or that emergency visit, much less how much it will cost you. And it doesn't stop there. To even get to the insurance companies or other payers, Mr. and Mrs. Chalk usually have to go through another layer of intermediaries, buyers such as their employer, their union, or their pension plan. Does your employer, your union, your pension plan act as a customer for you, as your agent to choose and pay for what you need at the best price? For decades, they have not. They have only chosen the payer, usually just choosing the health insurer with the lowest rates or the one they're most comfortable with. So look at this. There is no customer in this picture. George Hahn, like hundreds of millions of Americans every year, got caught in that wasteland of no customer. The first EKG was done by a cardiology group working within the hospital, but with their own contract with Hahn's insurer. The second was done by the hospital's own technicians with a different contract, all completely invisible to Hahn. So the first time, he ended up paying 3.4 times the reasonable price. And the second time, he ended up spending 62 times more than the reasonable price. And he didn't even know it until the bill came. So what will happen in healthcare? We are seeing now, and will be seeing, more and more attempts to cut through this morass of helpless intermediaries, to disintermediate, to help you, the customer, act like a customer, and your employer or union or pension plan to act like your agent as a customer, and your health insurer to actually help you pay for the services you need and might need at any point in the future, but at a price you can see and can afford for reasons that you can understand. Stay tuned for more on how this is going to happen. You can like this video right below here and subscribe to the channel to hear the rest of the story.